Hello, my name is Stephanie. I'm a physiotherapist at Flinders Private Hospital. This short video will outline information and exercises to assist you in your recovery following your knee arthroscopy. A knee arthroscopy is a keyhole procedure during which your surgeon may assess and address a range of different knee problems. The information and exercises contained in this video are for general advice following a routine knee arthroscopy. Always follow any specific advice and instructions given to you by your surgeon. Unless your surgeon tells you otherwise, there is usually no restriction to walking or weight bearing following a routine knee arthroscopy. This means that in most cases, no crutches are required and you should aim to walk as normally as possible, trying not to limp. If you normally use a walking aid, continue to use your normal walking aid. Initially following your knee arthroscopy, you should aim to walk short distances, such as around your home. Over the first 2 to 3 days, continue to walk short distances and spend some time on your feet while taking intermittent rests in between. Try to pace yourself and walk within your comfort levels rather than pushing through pain. Over the next 1 to 2 weeks, you should gradually but steadily increase the amount of walking that you're doing and the time that you're spending on your feet until you feel that you're back to your normal level of walking. Even if your knee feels good, do not resume running, jumping, sport or high-impact activities until after speaking with your surgeon at your post-operative follow-up. It is also important that you check with your surgeon before you resume driving a car. Most patients find that by pacing their walking and activities, they are able to minimise discomfort. Your doctor will advise you regarding pain-relieving medications and may provide you with a script if required. It is also recommended that you use ice packs to assist in reducing pain and swelling around your knee. Never place an ice pack directly in contact with your skin. Instead, make sure it is wrapped in a towel or pillowcase and then place the wrapped ice pack on your knee for about 15 minutes. You may find it helpful to use the ice packs after walking and after doing your exercises to assist in reducing any swelling and discomfort associated with activity. In addition to walking, it is recommended that you practice a gentle exercise program at home. The exercises will help you to regain normal knee range of movement, help to improve your circulation and reduce the risk of blood clots from forming in your leg, and also to strengthen the muscles around the knee. The exercises are outlined in the Knee Arthroscopy Physiotherapy Exercises booklet, which your nurse will provide to you on the day of your surgery. It is important that you practice the exercises within your comfort levels. It is normal to feel some stretching or tightness around your knee, and you may have some mild discomfort after doing the exercises, but you should not be pushing through pain. Most patients find that by practicing the exercises gently but diligently, they are able to regain good knee movement and strength. We generally encourage most people to practice the exercises between 3 to 5 times each day and to continue practicing them until you go back to see your surgeon at your post-operative follow-up. We will now go through the exercises. You may like to follow along in the booklet or have a practice yourself as we go through them. The first exercise is the foot and ankle exercise, where you should pump your feet backwards and forwards. You should perform this exercise on both feet and aim to start as soon as you remember when you wake up following your operation. This helps to get your circulation going to help prevent blood clots from forming. Aim to do at least 10 pumps of both feet every hour that you are resting during the day. The more you can move your feet, the better. The next 4 exercises should be practiced when you're lying on your bed. To perform the straight leg raise, bend up the good leg, placing your foot on the bed, and then lift your operated leg off the bed, keeping the knee as straight as possible. Hold for 5 seconds if you can, and then return to the bed. You should feel this working the muscles in the front of the thigh. If you feel any pain in your back during the exercise, do not continue with this exercise. Next, roll up a towel and place the roll under the ankle of the operated leg. Allow your knee to straighten. You may feel stretching along the back of the knee. If you can't feel a stretch, you can add some gentle pressure using your hands by pushing down on the front of your thigh. Do not push to the point of pain. You can hold this stretch for up to 5 minutes if you remain comfortable. It is also important to get the knee bending well again. Practice bending the operated knee by sliding your foot along the bed. Unless your surgeon has advised you otherwise, you should aim to bend your knee as far as you feel comfortable. It is normal to feel some tightness over the knee, especially in the first day or 2 when you still have the outer bandage on your knee. Just bend your knee as far as you feel comfortable. The inner range quadriceps exercise will help to further strengthen your thigh muscle. Place the rolled up towel underneath your knee so your knee rests on the towel. Straighten your knee and lift your foot off the bed while keeping the back of your knee on the towel. Hold for 5 seconds and then gently lower your foot back to the bed. Remove the towel at the end of the exercise and avoid resting for prolonged periods with the towel under your knee, as this can cause tightness at the back of your knee. The last 2 exercises should be practiced when you're sitting in a chair. To perform the knee extension exercise, lift your foot off the floor and straighten your knee as much as possible. Hold this position for 5 seconds and then lower your foot to the floor. You should feel this working the thigh muscles. The final exercise helps to improve your knee bend movement. Draw the foot of your operated leg back towards the chair as far as you feel comfortable. You can then cross your good leg over the front of your operated leg and use the good leg to help bend your knee as far as you feel comfortable. Hold this position for 5 seconds and then relax both legs. If you're having surgery on both knees or have pain in your other leg, just use your hands to assist in bending your knee. You can still use stairs if required, but if you can minimise the number of times you're going up and down stairs in the first couple of days following your knee arthroscopy, this will help to keep you more comfortable. Initially it will be easiest just to take one step at a time, placing both feet on each step. It will be easiest if you remember up with the good and down with the bad. So when you're going upstairs, you'll step up first with your good leg and then bring up your operated leg. When you're going downstairs, you'll step down first with your operated leg and then bring down the good leg. Keep repeating the pattern until you reach the top or bottom of the stairs. So that was up with the good and down with the bad. Please remember that it is important that you follow any specific advice and instructions given to you by your surgeon. We hope you have found this information helpful and that it allows you to be moving well as soon as possible.